Tonight we look at the health system in the Upper Peninsula. Reporter Ronnie Doss explored the topic and created a three-part series that will air later tonight. Ronnie?
Thanks, Donnie. In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act and getting proper medical attention. Tonight, we'll begin with the unique challenges of rural healthcare and the obstacles in our community. A 2007 study from a nonprofit medical research organization found that only 10% of physicians practice in rural areas.
Barriers to care is that there's just not enough physicians here. There's a lot of people that need primary care that have either transportation barriers that they can't get to care near them, or that there's just not care available near them in their own community. So when they have to travel a long way for specialty care or even for primary care, that's a big barrier, and so they end up not going, and so they present with higher acuity illnesses, and they don't get the care that they need to have the best life that they could have.
Find out more about the obstacles to rural healthcare this evening on CW5 News at 10, as well as on ABC 10 News at 11. This series will showcase the issues in rural healthcare, as well as a program right in our backyard that is helping train the next generation of healthcare providers, as well as some of the superstars of that program. We look forward to sharing that with you tonight. In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act in getting proper medical attention. In this three-part series, I took an in-depth look at the health system in the Upper Peninsula. From the obstacles of providing proper care to patients, a local program that is training the next generation of rural doctors, and a closer look at some of the talented doctors who are dedicated to making sure the unique needs of rural communities are met. Tonight, we begin with the unique challenges of rural healthcare and the obstacles in our community. The natural beauty of the Upper Peninsula makes it one of the most unique places on the planet. For many, the lure of the Upper Peninsula is large open spaces and seemingly limitless outdoor opportunities. Unfortunately, that also creates a physical obstacle in getting the proper health care when a medical issue arises.
There's patients that can't get to the physician because their snowmobile is broken down and they can't get to the road to get to their car to get here. So that's something that I've never had to think about in medicine before. And so seeing a patient like that really gets your mind working in different ways to say, how can I help this patient in a different way than I've ever had to think about it before?
That ability to focus on the unique needs of rural populations means a doctor or nurse has to be more flexible in how they provide care, as well as take on more responsibilities.
Being in a more rural community, we get to work with a lot of physicians that kind of have to do multiple different things. So they're not just focusing on one specialty, like the family physicians here in the UP focus on, like they do a lot of pediatrics, some will do some procedures just to try to help their patients not have to travel quite as far. So a lot of the providers that we work with, not just primary care, but specialties as well, they're doing a broader spectrum of care.
Beyond overcoming barriers by providing a broader set of services, rural areas also lack the personnel for specific types of medicine.
Primary care physicians are often the only physicians in the community. There are a lack of specialists in rural communities.
This lack of specialists also leads to situations where patients don't have the resources they need or must drive long distances to get any care at all. Nicole Bradshaw, who was the author of a study from the Citizens Research Council of Michigan, says 1/3 of medical school graduates were from rural areas, but now it is about 1/4. She went on to say that unless you have some sort of tie to a community or always intended to go into rural health, research shows most physicians are unlikely to practice in a rural area. A 2007 study from a nonprofit medical research organization found that only 10% of physicians practice in rural areas.
I did grow up in the Upper Peninsula, so I did see kind of those health disparities. We had to drive, 1, 2, 3 hours to get specialist care. I had never heard of a psychiatrist. I never had a pediatrician. Like, it was always just, your basic family doctor.
Even though the Michigan State University College of Human Medicine UP campus finds passionate students who are interested in rural healthcare, another issue is the economic factors of healthcare. According to an article from MLive, national research suggests that a shortage of primary care can lower the quality of patient care even as it drives up costs.
Healthcare is like any other business. It relies on volume to be sustainable, right? So, it's very difficult if people can't access that.
An analysis by the American Academy of Family Physicians found that having one primary care physician for every 1,200 people is reasonable. In the United States, it is just over 1,300. In Michigan, it is close to 1,250. The Citizens Research Council found that the bottom 10 counties in Michigan are all rural counties that range from 3,000 people to a physician to nearly 7,500 people to one physician. If these trends continue, the shortage of rural primary care physicians in Michigan will get worse as older doctors continue to retire. Tomorrow night, we will continue to explore the challenges of healthcare with a look at a bright future for the UP. Join us as we share a local program that is helping train new doctors to deal with the unique challenges of rural health.
Tonight, we look at the health system in the Upper Peninsula. Reporter Ronnie Doss explored the topic and created a three-part series that will air later tonight. Ronnie?
Thanks, Donnie. In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act and getting proper medical attention. Yesterday, we discussed the unique challenges of rural healthcare and the obstacles in our community. Tonight, we continue that series by discussing a local physicians program that is helping train new doctors to deal with the unique challenges of rural health.
There was a man at Michigan State University who was the dean. His name was Donald Weston. He's dead now. He died just a couple of years ago. And he was an iconoclast. He was a well-trained physician who looked at the way doctors were trained classically and said, that's fine, except that doesn't help small town rural areas. And what we need to do is get more actual learning in rural areas, in small towns, so that the people who are, when they're trained there, they're more likely to stay there. It'll help overcome the access problems that small towns have always had to primary care physicians.
Find out more about the next generation of rural physicians this evening on CW5 News at 10 p.m. as well as on ABC 10 News at 11. This series will showcase the issues in rural healthcare as well as a program right in our backyard that's helping train the next generation of healthcare providers as well as some of the superstars of that program. We look forward to sharing that with you tonight. In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act in getting proper medical attention. In this three-part series, I took an in-depth look at the health system in the Upper Peninsula, from the obstacles of providing proper care to patients, a local program that is training the next generation of rural doctors, and a closer look at some of the talented doctors who are dedicated to making sure the unique needs of rural communities are met. Tonight, we continue that series by discussing a local physicians program that is helping train new doctors to deal with the unique challenges of rural health. Rural areas like the Upper Peninsula have unique health challenges including weather, distance, access, economics, and a crucial shortage of doctors and specialists. The lack of doctors and specialists in the Upper Peninsula is why the Michigan State University College of Human Medicine Upper Peninsula campus is such an asset to our community. The campus was established in 1974 and is a pioneer of the rural physician program.
I'm in a unique position because when it comes to history, I can pretty much say what I want because nobody else can remember. When I came here, I was the 30 some odd doc here. You can imagine that. There's 200 and some odd now. I mean, it's a whole different world. And specialties had just barely begun.
Medical students complete their last 2 years of medical training in rural locations, a benefit for the future doctors as well as the communities they serve.
Knowing your community is very important because that really helps you understand the resources that that community has and the resources that they lack. And knowing those really helps you help patients navigate through those either surplus resources or lack thereof, and helps you help the patient get the best care that they need.
The program is affiliated with the UP Health System of Marquette, which is the primary training site. Students also have the benefit of hands-on learning at sites across the Upper Peninsula.
We're able to do a program called Compass, where we get to learn about outdoor wilderness medicine, and I think that's a huge part to the UP.
This connection creates a bond with the community these doctors serve.
I want to provide great health care, but I also want to be a mentor to as many people as I can in these small communities, because I think there's a lot of untapped potential in small communities.
That passion for rural areas from students at the UP campus goes beyond borders to provide healthcare for underserved communities around the world.
I got interested in healthcare while doing international work, actually, and so that's something that I want to incorporate into my future career, is I want to do rural medicine and also do international relief work. I saw the needs of a community in a way that I had never seen needs before. And I realized that I wanted to spend at least part of my life meeting those needs and helping people in those situations understand that they're not alone. Because I know I can't do everything, but if you do something for someone, I think that makes a big difference for them.
The compassion, dedication, and hard work of the students at the Michigan State University College of Human Medicine Upper Peninsula campus builds a bright future for rural populations in being able to properly access healthcare resources. Tomorrow night, we can conclude this series on healthcare in the UP by shining a light on some superstars of the Michigan State University College of Human Medicine Upper Peninsula campus. Join us as we share the hard work and determination of these talented students who received a scholarship for their dedication to rural healthcare.
Tonight we look at the health system in the Upper Peninsula. Reporter Ronnie Dawes explored the topic and created a three-part series that will air later tonight. Ronnie?
Thanks, Donnie. In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act in getting proper medical attention. First, we discuss the unique challenges of meeting rural healthcare needs and the obstacles in our community. Then we continue that series by discussing a local physicians program that is helping train new doctors to deal with the unique challenges of rural health. Tonight, we look at a few of the talented superstars of the rural physician program.
Everybody has to meet requirements. But when you are wanting to practice rural medicine, you really do need to go the extra mile. We want yes students.
Find out more about the next generation of rural physicians this evening on CW5 News at 10 p.m. as well as on ABC 10 News at 11. We look forward to sharing that with you tonight. In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act in getting proper medical attention. In this three-part series, I took an in-depth look at the health system in the Upper Peninsula, from the obstacles of providing proper care to patients, a local program that is training the next generation of rural doctors, and a closer look at some of the talented doctors who are dedicated to making sure the unique needs of rural communities are met. Tonight, we conclude that series by discussing a major obstacle medical students face, as well as shining a light on the bright students who are practicing rural healthcare in our community.
These are young, highly motivated, skilled people who have dreams.
Earlier this year, 6 medical students from the Michigan State University College of Human Medicine Upper Peninsula campus received the MAZZUCHI Scholarship.
Dr. Daniel MAZZUCHI is the primary reason, the primary physician of why this program exists. He had the determination and put in all the energy and hard work to get training happening in the Upper Peninsula.
The retired doctor humbly reminds every scholarship recipient where the support comes from.
The scholarship that they got, while it's named for me, is not from me. It's not my money. It's from the community.
The money for the scholarship comes from local business owners providing donations, as well as residents putting a portion of their will or estate into the funding. A large number of physicians who are being paid to teach even put their own paychecks into the scholarship. The fabric of the Upper Peninsula is built on helping one another, and everyone we spoke to agreed that the expense of medical school was an issue.
It's not easy. I mean, the expenses of medical school are horrendous.
I don't think a ton of people realize just how much debt a lot of physicians have to go into.
Medical school is very, very expensive.
The financial burden for us students to be able to focus on our education.
The financial worries.
Financials.
The finances as I make decisions of what my future is going to look like.
The students who receive this scholarship understand the need for healthcare in the Upper Peninsula, such as NATALIE Thompson from Gladstone.
My mom personally, she had breast cancer and she wasn't able to get some of the services like radiation treatment. She wasn't even able to get it here or in Escanaba, close to where we live. When I was applying to medical school, I knew I wanted to do rural medicine.
Rural physicians face unique challenges and are characterized by their hard work and passion for the career.
Our goal is to train people who want to care for populations in rural communities. That is the number one goal, and we know how difficult it is. You have to have grit and determination to be a rural physician.
These skills are critical for an area with specialized needs such as the Upper Peninsula.
It is important for homegrown physicians to return back, and even for those who aren't from here to return, because just training in the UP is very important towards creating physicians who are prepared to care for the population of the UP, just because the needs that the people face here are different than those in other rural areas.
Beyond understanding the science behind medicine, being a rural doctor requires a homely approach that focuses on the patient's needs.
The best physicians now are those who are the most compassionate and have the best interpersonal skills that can motivate their patients and kind of do some of those intangible things.
As difficult as medical school can be, Josh Cole, who is a first-generation college graduate, has some advice.
Even though it seems insurmountable, you can get there. Rely on your family, your friends, your counselors, everybody around you. The community that you live in is really how you propel yourself forward. And that's something in the UP that is probably the strongest asset of everybody around is the community.
A sentiment shared by fellow third-year medical student Jenny WICKENS.
Being able to rely on other people, being able to ask for help. So a little bit of humility goes a long way in the medical field because none of us know everything and none of us can do everything. And then as far as sustaining, I think you do need empathy for others, and certainly everyone at this campus that I've ever met, all the faculty and all the students here definitely have a lot of empathy and a lot of care for their community. And so they're not just doing it for a job, they're physicians here because they love these people and they love this place.
That love allows rural physicians to take an active role in the local community.
You get to be a part of the community in which you're working. Really becoming a staple of that community really helps you feel like you are serving that community and being more engaged with them.
Thanks to the Michigan State University College of Human Medicine Upper Peninsula campus that has served the community since 1974, the programs at the campus have developed the necessary skills of 310 medical students and 210 family physicians. This year shines a light on our healthcare workers as heroes, and these scholarship recipients continue that legacy, providing a much-needed resource to our community. I'd like to thank the amazing students and staff who dedicated their precious time and provided their enthusiastic energy for these interviews. Your effort was greatly appreciated. Congratulations on receiving a well-deserved scholarship, and my sincere gratitude for your help in allowing me to get a more in-depth understanding of meeting our rural healthcare challenges, the program that is rising to meet those needs, and the amazing students who are dedicated to our community's health.